Good afternoon. Welcome to the launch event of the Toolkit for Tackling Misinformation on Non-Communicable Diseases. This webinar will be recorded and made available later. And also, this event is live streamed on WHO Europe social media channels. So I hope that during the next 90 minutes, you will get to know about this new toolkit that we are launching to tackle misinformation related to non-communicable diseases. My name is Kremlin Vikramasinghe, acting head of the WHO European Office for Prevention and Control of NCDs. And non-communicable diseases account for nearly 90% of the disease burden in WHO European region. They include cardiovascular diseases, cancer, diabetes, chronic lung diseases. But the risk factors attributed to them include tobacco, alcohol, unhealthy diet, physical inactivity, and air pollution. So a lot of information that we gather on the internet about our lifestyles and related to these risk factors contribute to the burden of non-communicable diseases. That's why we think this topic is very timely given the disease burden in our region. WHO European Office for Prevention and Control of NCD supports the 53 member states in reducing the NCD burden and achieving the Sustainable Development Goal Target 3.4. So we hope this toolkit will be another opportunity to advance our progress to reduce the burden of non-communicable diseases. First, I want to bring greetings from our Regional Director, Dr. Hans Kluge, and also our Director for Country Health Program Division, Dr. Nino Bersoli. We have a short video from our Regional Director, and we will watch that first. Thank you.
Representatives of Ministries of Health and National Health Institutes, colleagues and friends. Non-communicable diseases have long been the leading cause of death in the WHO European region, across 53 countries covering Europe and Central Asia. But they are also largely preventable. The appetite for health-related information among the general population, the people we serve, is growing. According to Google, the total daily health-related queries at the end of the last decade, in 2019, just before the pandemic, amounted to more than 70,000 per minute, or more than 1 billion a day. Queries on conditions, symptoms, medication, health insurance, and the list goes on and on. Since then, the numbers are likely to have grown considerably, considering the unprecedented times we are living in, with multiple health crises and emergencies. The internet is increasingly used as a source of health information. At the same time, it is often difficult for the average person to distinguish between relevant information, misinformation, and disinformation, which can lead to damaging behaviors and that are, at the end of the day, a real threat to public health. COVID-19 is a case in point, where half-truths and outright falsehoods coexist alongside scientifically and medically factual information on websites and social media platforms. The spread of misinformation is a big, profitable business, and the internet is rife with harmful statements promoting health benefits of alcohol, claims that downplay the risks of novel tobacco products, or outright incorrect, misleading nutrition advice that contributes to the burden of non-communicable diseases. We have, simply put, reached a point where governments, international health agencies, and social media platforms have no other choice than to learn how to manage and control misleading information on NCDs. In line with the European Programme of Work, which lays the foundation for the work we do at WHO Europe, the WHO European Office for the Prevention and Control for NCDs works towards environments that enable and support a healthy lifestyle. To discuss pitfalls, successes, past experiences, innovation and hidden opportunities, to turn a negative into a positive, WHO Europe has established a platform inviting the participation of civil society and NGOs, social media companies and member states. Because if we are to succeed in counteracting NCD misinformation, all stakeholders need to work together. We need strong initiatives to control the impact of misinformation. We need to strengthen capacity for and in every member state. We need to learn from mistakes made during the COVID-19 pandemic, turn weaknesses into strength, and develop long-term, high-impact strategies. Digital information is a powerful tool, and we need to urgently up our game in order to turn it into an advantage, not a disadvantage. The internet should promote health and well-being, not the opposite. And today we are taking a big step in that direction with the launch of the NCD Misinformation Toolkit. Congratulations to all of you, and may this serve as a template for similar efforts on a host of other issues going forward. Thank you and congratulations again.
Thank you to our regional director for those opening messages and greetings. Next, we are going to present some key findings from this toolkit from two of the key authors who were involved in developing this and who worked with us for months or years actually to build this up. So it's my great pleasure to invite João Mariocas, who was a consultant with the NCD office, but also Francisco de Abdo Durat will join him as a joint presentation as authors of this toolkit. João and Francisco, floor is yours for your presentation.
Thank you so much, Kremlin, and thank you all for being here. Welcome. Today, after one pandemic, 3 high-level meetings, and almost 2 years since we started this project, we are launching the toolkit for tackling misinformation on NCDs. And it was a pleasure for us to have been able to drive this project to this day, and we hope that it contributes positively to the development of good policy making on health misinformation. I will, yeah, the presentation is going up, and we'll start with the agenda. The goal here is to briefly discuss the scope and goals of the toolkit, the problem of health misinformation on NCDs, the consultation process that we engaged in, and the conclusions of the toolkit. And we will then welcome discussion. We don't want to prevent it, so we'll try to be brief and leave a lot of space for questions and discussion. The toolkit was made following 3 high-level meetings that were organized in the context of an initiative called the Forum for Tackling Misinformation on Health and NCDs, organized by the WHO European Office for the Prevention and Control of Non-Communicable Diseases. And our motivation to start this was, on one hand, the understanding that there were growing dangers of health misinformation, and on the other hand, the lack of particular attention given to it in the context of NCDs. And in fact, our early research that predated COVID-19 revealed that most of the health misinformation literature was focused on either big events, such as epidemics, or conspiracy theories, such as those related to vaccination. And our idea at that point was to study what kind of developments could be made in the specific case of NCD misinformation, which is a type of information that is less impressive, so to speak, but more pervasive. And COVID-19, however, changed the landscape of health misinformation initiatives dramatically. And the scope of the toolkit was, again, so to speak, amended to focus also on how some of those initiatives could be used to fight NCD's misinformation. And so our goals with the toolkit were to investigate causes and consequences of the problem by reaching out to main stakeholders at the government, industry, and civil society level in order to prepare a toolkit that could be used by policymakers to design and implement good policies. And when we talked about NCD misinformation, we were talking mostly about the kind of misinformation that is often present in corporate advertising, social media content, poor scientific reporting, and common popular myths. We have several examples for this, old and new. None of them will be new to you here today. But you know that a lot has been done in the past years in order to curb misinformation, for example, related to alcohol, and regulation around advertising alcoholic products was implemented. But even though that was the case, the idea that alcohol to a certain degree is not only not harmful, but beneficial is one that resurfaces quite frequently under the guise of actual science. You can see some examples there. They go from stuff that was published decades ago to things that could be found online in the past years. Diet and nutrition topics, which are also under-researched from a misinformation perspective, despite being some of the most consumed contents online. And these are topics where influencers thrive. They produce contents that are consumed by millions of people on lifestyle choices, physical exercises, body image. And the research supports the idea that there is widespread misreporting and misinformation on diet and nutrition topics, not only on social media, but also in traditional media. As with alcohol, another example, tobacco's advertising, also heavily regulated, which curbs to a certain extent what we can call corporate-driven misinformation, but articles sustaining the benefits of certain alternatives, marijuana, e-cigarettes, vaping, have been on the rise and are likely to continue. And so misinformation has consequences, and this was basically why we decided to move forward. It has consequences because it leads to the adoption of harmful behavior. It leads to the adoption of innocent behavior in detriment of actual treatments. It leads to emotional distress. It undermines public health policies, and it discredits public health institutions, science, and the industry. And we've seen this all happen firsthand during COVID. And so we were aware when we started this project, COVID was not in place. But as soon as it happened, we were aware that as we were reaching to stakeholders during an infodemic caused by COVID-19, that was where their mind and efforts were. So rather than trying to steer the conversation away from COVID-19 to focus on NCDs, we leaned on that impulse that was already there to understand what could we do against health misinformation in a period of stress and urgency, and then learn how those initiatives could be applicable in other contexts, less urgent, less stressful, but equally important. And so we have identified key representatives of the different stakeholder levels in government and public health authorities, in European institutions and regulators, traditional media, digital platforms, academia, NGOs, startups. And our goal was to absorb their knowledge, learn about their initiatives, map concerns and challenges, and then transport those into a toolkit for policymakers. And in doing so, in that effort, we have managed to map a number of different initiatives and categories of approaches that have allowed us to have a comprehensive view of what is being done and what can be improved and developed. And one of our main drivers, and that is perhaps the overarching concept of this initiative, was this notion that for all the efforts being made in the different levels to create and implement solutions, there was still space to improve on collaboration between stakeholders. Legislation on health misinformation was still in its infancy, needed to very much address both the industry role, especially that of digital platforms, and this is a bigger discussion that has been taking place in the past years, but also the civil society role, and namely regarding media literacy and media literacy strategies. Likewise, the civil society has been implementing many solutions, innovative solutions, that could be scaled and expanded if coordinated with digital platforms or supported by state initiative. And so the WHO, from the beginning, before COVID and during COVID, was at the forefront of this call for a triple entente against misinformation. And COVID-19 illustrated this opportunity clearly, and we witnessed multiple examples of that cooperation. Francisco will showcase some of those, and will then proceed with the conclusions of the toolkit. But this notion that collaboration is at the heart of what we wanted to do is very much present, both in the idea of the toolkit and hopefully in its follow-up. Francisco, if you want, go ahead.
Thanks a lot, João, for giving us this background on the causes and the scope of our work. So what I want to do right now is explain a bit the results of the process of this getting together process and some of the conclusions of the toolkit. And so as we were drafting the toolkit, we obviously found many interesting projects, many initiatives that I think we thought deserved support to sort of expand their reach, expand their impact. And unfortunately, we don't have the time to discuss them all. Because we really want to listen to the players more than spend a lot of time just showcasing the report. But some of the key players are here for discussion. Avaz is here, the Patient Information Forum is here, YouTube and Google are here. And so we are really looking forward to the discussion after these conclusions and to see really if this toolkit is useful for the different players, including, and I would say for most member states of the WHO. And starting with member states, what we found out very quickly was that member states play probably one of the most important roles in defining the terms of cooperation between these different levels. So we understood very quickly that their motivation, their initiative was crucial to gather the various stakeholders and sort of provide a sort of platform of discussion and exchange between both public and private actors. So member states continue to play the key role in getting everyone together, and this is something we assumed in the report from the front start. Some examples of things that were done before and during COVID. Croatia, for example, had multi-channel campaigns through social media that included the use of celebrities and Croatian influencers. So there was already a sort of cooperation between the government and key players of civil society to transmit health reliable information. Portugal, who is here today in the person of Miguel, developed extensive projects on health misinformation. They built, for example, during COVID, a really big information platform and developed shareable infographics that I can say, as a Portuguese, they were widely disseminated on Instagram and Facebook. And there was also, I would say, some success with a new concept, which was the true or false concept, where a fact was presented and then users were sort of invited to guess whether it was false. So this sort of, again, cooperation between citizens and governments to enhance health information. And then Estonia, for example, also during COVID developed a specific web page and launched, again, with Estonian celebrities and influencers, several campaigns to raise awareness. But one thing I would note that was interesting was that the Estonian representative during our meeting really said that we were lacking a sort of NCD joint strategy, and that they had learned a lot with COVID, and they would be welcoming to get these onto the NCD and other health crises. And so here's a really interesting example of from Belgium. It's a platform that where basically health content is reviewed by a panel of patients to check that it is comprehensible before it is shared publicly. So the process is the Belgian government, the institute responsible for this, creates content, and first, before launching it publicly, checks with patients to see if the information is understandable. And then these sort of health information posts are normally connected to current events of popular culture. The example you see on the right, for example, was on Lyme disease, when Justin Bieber, the famous singer, was diagnosed with that condition. There was a lot of misinformation around it, and the Belgian government decided to do a sort of what they called a pimped up image of their Minister of Health as Justin Bieber to provide good and reliable health information. So clearly you see here an attempt to package the information in an appealing way, mainly to sort of younger audiences. So member states are doing a lot, and they've been doing a lot, and I think there is still room. But the key takeaway from this is member states can coordinate and can serve as a platform for these many initiatives. Social media has been doing a lot before and during COVID. For example, they have fought health misinformation with content labeling and prioritization. I'll give you a couple of examples. They have done a lot of work on user nudging and redirecting. But the result, I think, of the 3 meetings is that there is still a lot of room for further collaboration between social media platforms and other stakeholders on, for example, source certification, algorithmic transparency, and also, and perhaps for most researchers, use access to data, all in a way that civil society can be as engaging as other parts of society on tackling health misinformation. So here are some examples of what, for example, Facebook Meta has done during the COVID. You can see the example right there throughout their different platforms. They have collaborated very closely with WHO to redirect users to reliable sources of information regarding, at the time, COVID-19. You can see, for example, in Facebook, there was this pop-up that would show. WhatsApp would also send these messages saying, here's the good information. Please check these before you see other sources. Twitter did something similar, sort of nudged users towards specific content and created what is normally called access friction. So it created an obstacle for some users to access content which was deemed to be dubious or not in accordance with the guidance that came from mainly WHO and national authorities. And YouTube, who is here represented, and we will say a bit more on that, has developed also extensive work on misinformation policies. A good example of that was the ultimate decision of excluding Brazilian President Jair Bolsonaro from the platform for a week, precisely on the prohibition of promoting dangerous remedies or cures. So social media has been doing quite a lot, but we feel that there is room to do more. And then we also invited media, traditional media, and they continue to play, of course, a key role in sort of gatekeeping reliable health information. And there's a lot being done at that level. Think, for example, about fact-checking programs, routinely advising on misinformation campaigns. And in one of our meetings, we went a bit further, and we even invited a sort of cutting-edge project that is being developed by New York Times in cooperation with IBM. You can see there, it's called the News Provenance Project, that basically uses blockchain technology to identify news sources. So it's a groundbreaking, very cutting edge technology to help us any sort of misinformation, but that could easily be used to also be applicable to health misinformation. And we felt that there is further collaboration to happen between media outlets and civil society, mainly on sort of piercing through the informational bubbles that sometimes social media cannot reach. And so civil society can help media sort of guide media's information to the ultimate goal, which is the consumers of health misinformation, which are internet users. And so very quickly, a couple of examples. New York Times has really found out, I think that's a very interesting conclusion, that older users are seen to have higher levels of trust and lower awareness of cues, which means that they are less prone to health disinformation. And so what they said that they were doing was really a tailor-made approach. And that tailor-made approach is easily, again, extensible to, if we want, to health misinformation. Thomson Reuters during COVID partnered as well with the National Association of Media Literacy, and they made these fantastic videos instructing people how to spot COVID misinformation. This can be easily done if we want within the realm of NCDs with cancer, alcohol, lung diseases. And of course, civil society, and we were very keen on really welcoming civil society into this report as well. And they have played a vital role in monitoring both the internet platforms, and this goes from search engines to social media to websites, but also governments to some extent. And they have sort of held these, all of these players to account, and they worked with them to provide what we think is the easiest way for users to find reliable health information. And there's a lot that was done, from detoxifying algorithms, synthesizing complex evidence, for example, or directly providing sort of reliable information sources. And here are some examples that we've gathered in the report, and I really recommend you to read the report because you will see all of these projects very highly developed. A good example is the sort of browser add-ons that NewsGuard and HealthGuard developed. And so these are extensions. You can try them in your browser. They're extensions produced by a team of journalists, and they rate according to certain criteria. They rate and revise the reliability of health information from websites. So you can see an example here. You go to a website, you check their browser extension, and you see whether the website is credible according to and transparent according to some criteria. The Avaz Foundation has done really key work on that. I'm very glad that we have them here today. There is a sort of global anti-misinformation campaign, which focuses on Brazil, the United States, and the EU, but as a sort of global scope. And what I think is one of the key conclusions of that campaign is that Avaz found out that when you actually provided corrections to social media users, so when you show them they were wrong and provided good information, their sort of belief in the disinformation was reduced by half, which is a fantastic number. And so, I mean, the organization has done fantastic work on Facebook as well, and I suggest you read the report and you see what they've done. And then another example is PIFTIC, who's also here today, the Patient Information Forum Trusted Information Creator, which is a nonprofit and also works with a sort of credibility scheme. They are based in the UK, and we'll have the chance to listen to their work a bit more. But again, it helps organizations to transmit information, health information in a good and reliable manner. So we are very happy to have them here today as well. To finish this and to give time for the discussion, our conclusion is that there is a lot that was done, especially COVID-19 was a fantastic moment for the fight against health misinformation. It was a terrible moment for humanity and society, but it was a good moment for those who want to fight misinformation. And we wanted with this toolkit to inspire other stakeholders, member states, civil society, industry, to showcase what they've done already, but most of all to start talking to one another and to hopefully create a platform in which all of these different parts of society could coordinate and push forward. We are of the belief that nobody wants misinformation, either in their platforms, either in civil society, either at the member state level, and only together we will be able to effectively fight it and effectively erase it from the internet. 2 words on just to say that it was a pleasure for João and I, as well as Francisco in the coordination to do this report. And we hope it's useful, and we are always open to further collaborations and further improvements of the report in the future. Thank you very much, and I will leave it now to the most important part, the discussion.
Thank you, Francisco, and thank you, João, to both of you for that presentation, but also for all the work to develop the toolkit. Toolkit is now available live on the WHO Europe website, on the publications and the NCD office webpage, and many other NCD risk factor related web pages. It's live now, and you can access it and read more for more details. We will also share a link, those who are joining us on the Zoom channel, but also on the social media channel, there will be a link available for you to access it. Thank you. Now, as you heard, we learned a lot from COVID, different examples that we could apply to NCDs, non-communicable diseases, but also WHO has many teams are working on this topic. So we are going to hear a couple of updates from World Health Organization, from the regional office, but also from headquarters. First, it's my great pleasure to invite Dr. Joao Breda, who is the head of the Athens Quality of Care and Patient Safety Office, because this topic is very relevant from that angle as well, who is a senior advisor to WHO Europe Regional Director. Dr. Joao Breda, floor is yours. Thank you.
Thank you. Thank you very much, Kremlin. I'm really impressed, and it's a pleasure to be here with you today. First of all, I think I would like to start by acknowledging the great vision and support by the regional director. He was the first one to believe in this a bit weird and out-of-the-box project when we started discussing it some years ago. And we really provided a lot of insight and really great support in terms of getting it done, getting the stakeholders on board, working a bit beyond the traditional boundaries. And I think that was really fantastic. I think that's only with the visionary leaders and support like this, we can really achieve many of the innovations that we are so keen to put forward in the WHO Regional Office for Europe and in the WHO European region. So my first words go in that direction, and I'm very keen that we started this work about 3 years ago, and it's really fantastic to see how fruitful and how interesting and important this report is. My second point is really to congratulate all the stakeholders involved, and I start with the member states. I remember many countries involved, so excited. We were not sure when we began that this really would raise the interest of the member states, but the support was incredible. There was a lot of humility, people understanding that we didn't understand much about this topic, and it was really interesting and exciting to see how we were learning from each other, particularly those stakeholders that know more about the topic. I mean, notably those from the industry, those from social media platforms, the very, important NGOs that have been working in the area as well. So I would like to really congratulate and thank all of those that were involved from day one. So I really think that this kit, the toolkit, the report, they have reached very nice maturity level, and they actually bring a lot of insight for an area where people normally wouldn't see as being touched by misinformation. But those of us who have worked in the alcohol field, in nutrition and other areas know that this is really also very important. Maybe the misinformation is less spectacular, is more, but maybe more pervasive, and therefore you have to be really very, very careful. So I think that this is very important. I think that this is really an innovative approach on how to engage with different stakeholders, on how to discuss and to bring together to the same table. We started this project almost at the same time that the pandemic was really taking off and becoming something really serious, and we couldn't believe how much interest it really gathered after a while. I remember we were very much inspired by the work done by WHO headquarters colleagues that were, and that's very well pointed out by Joao and Francisco, there was really already a lot of work done at the time by WHO globally, really on the driving seat of the forefront of these aspects. So I think there's a lot of creativity and innovation here, particularly in terms of the social aspects where we bring all of these people working together and really learning from each other. Now, after moving to an area of quality of care, I actually look back and I see how important it is that we also look at misinformation from the perspective of quality of care. information of citizens, but particularly of patients, those who need to get the services from the health facilities and the health system. This area is really very important to ensure that we are not undermined in providing the evidence-based care, but that also patients understand it and they get the care that they deserve. So I'm actually delighted to say that together with my colleague, Dr. Vikramasinghe at Kremlin, we are already discussing opportunities to work together in terms of joining forces, looking at the quality of care perspective and also misinformation. So it's great to see you've triggered a lot of action, which we would like to continue. So in a nutshell, just to say that it's a great pleasure, congratulations. I believe that we can advance more UHC, promoting well-being, and also addressing emergencies in a better way with work like this one. We are really covering significant gaps in the NCD area and the NCD information, and therefore I'm really very much looking forward to continue to work with my colleagues in the regional office and beyond to really address this issue in a more decisive manner. Congratulations for the drive and the innovative mindset, and very much looking forward for the discussion. Thank you very much.
Thank you, João. Thank you so much. And as you heard from Dr. João Breda, non-communicable disease control include both prevention, addressing risk factors, but also management for the patients who have diseases. And this topic is equally important for both sides, for the prevention and management. And that's why we think there is a great opportunity as we take this agenda forward to look at it from the quality of care angle as well. And thank you, João, for those words and also for how we could take it forward for future. We always like to learn from other areas of work within the WHO. So today from the WHO headquarters, we have Dr. Tim Nguyen, who is the head of unit for high impact events in the global infectious hazard preparedness, who has done a lot of work during the last few years on this topic, a lot of experience and knowledge that as NCD team we can learn from. Tim, thank you for joining, and over to you now.
Well, thank you very much, and thank you, colleagues, for inviting me and sharing our experience on addressing what we call the infodemic and the fight against misinformation and building community resilience against misinformation. So first of all, let me send my congratulations to the team for really putting together this toolkit. And really, the key message around the triple entente is so vital, as we fully concur with this. To address this societal challenge, it is a whole of a society approach where we need to bring together governments, civil society, the industry, which here we mostly need to include the social media platforms to really address this new phenomenon that is just being amplified by our use of social media and the way the information ecosystem actually is further evolving. What we think right now is the standard. I think in 5-10 years, we really look at a different system. And the earlier we start to really addressing this as a whole of society approach, the more important it is, because it affects us also. First of all, congratulations to come to this conclusion. This really concurs with our experience during health emergencies, when people are fearful, when people are impacted in their daily life through the measures we have to do to control in emergency. And this also happens, as you have pointed out, in other health areas, in NCDs, and João mentioned also in healthcare settings. So bringing these resources together, the more important. One thing I would like to highlight, and I encourage you, is really to, as part of your toolkit, to also invest into research around this area, because we need now evidence-based tools that help us to mitigate misinformation and build resilience against misinformation in populations. There's a lot of efforts that has been invested now during the COVID-19 pandemic, and we need to sustain this form of research that will help us to identify intervention strategies. We will hear maybe a lot about pre-bunking, debunking, inoculation attempts, but most of this is more practice and done. Research is mostly done, in controlled research settings. But we really need to know how these intervention can also be applied at population level to increase resilience against misinformation in population through health promotion, through sensitization, through different forms of literacy, health literacy, digital literacy, and I think this is a next step that we need to emphasize while the toolkit, hopefully evolve over time and invest into creating that knowledge that will help us to design and invest into the right interventions. So I stop here and thank you, everybody.
Thank you, Tim, and thank you for those comments and also the learning from your experience of managing this, how we can apply those lessons to NCDs, both prevention and management. Thank you. With that, dear colleagues, I'm going to hand over to my colleague, Francisco de Silva, who was part of the editorial team for this toolkit with our NCD office, to introduce the panel and moderate the panel discussions in the next kind of 40 minutes. Francisco, over to you, and thank you for moderating this panel.
Thank you very much, Kremlin. First of all, I would like to congratulate everyone here that participated in this report development. This has been like a journey, almost 2 years or more than 2 years now. And I would also like to thank more particularly to the person that believed in this project since the beginning, Professor João Breda. When we came to him, me, João Marecos, and Francisco, with an idea like this outside the box idea. So thank you very much, João. And also to Karina Ferreira Borges and to you, Kremlin, that followed up with us and always supported us to come out with this toolkit in the end. Secondly, I would like to thank to all the participants. So I was very surprised when we got to one of our consultations, one of our meetings, and we got like 40 member states present online. It was something very big that showed that member states are not only concerned, but also committed to actually to address these challenges. And finally, to all our partners that participated on behalf of the industry, social media, and academia, and also the NGOs. So it was a huge effort, but we made it. Congratulations to us all. So building on my pathway as a digital consultant, I just wanted to refer that right now I work for YouTube, but I'm not managing this panel in that capacity. I'm managing this panel in the capacity of one of the report co-authors. And as we've heard our regional director referring, actually, I would say the word that is like the most important word from this report is collaboration. This triple intent and how to bring together different stakeholders to achieve a higher good. And I would like to organize this panel discussion according to 3 main questions. And I would like all of the participants to keep very strict to the questions. So the first question would be to highlight successful case studies of collaboration between different stakeholders in fighting NCD's misinformation. And we've seen it, and the report is full of them. There are plenty of good examples. The second question would be, what are the challenges? Because there are still several challenges that governments face, that NGOs face, that even the social media platforms are facing. And let's hear about that. And finally, how can the WHO help promoting this report and also taking these ideas forward? So with no further delays, let's hear first from our 3 guest member states here, starting with Dr. Neville Calleja from Malta. Dr. Neville, are you there?
Yes, hi. Hi, Francisco. Thanks for the invitation.
You have the word, and tell us about a case study, challenges, and opportunities.
So, so to be honest, I've been involved both at member state level in epidemic management in COVID particularly, but also with the WHO Geneva, particularly in the training of the epidemic managers globally. If I have to limit myself to an experience locally, I think our experience was we basically did not invest huge amounts of money in epidemic management. We're a small state, and we could not mobilize a huge amount of money, so to say, to manage the epidemic. But it's also possible to do it without a lot of money. That's the message I'm trying to deliver here. So through monitoring of what is going on within social media, especially local large groups, again, you can monitor the whole, nobody can monitor the whole social media landscape, but by monitoring some of the larger groups within social media, we sort of organized our own social media listening hub, so to say. And that helped us to organize our, sorry if I may use two official terms here, pre-bunking and debunking. Okay, so loading with the correct information as soon as we spot a misinformation trend creeping in, particularly maybe from another country, and also debunking if the misinformation already establishes itself within communication. But I think one best practice I'm particularly proud of here in Malta, and I think it was also critical also to achieve a high vaccination rate in this country, is that we worked a lot with the primary care physicians. Primary care physicians are busy. I'm not sure about your countries, but in our country, they're very, very busy. They have huge clinics, and they may not always have the time to keep abreast with the latest evidence that came out this week or this morning. So we invested a lot in trying to keep this population actually abreast of the latest evidence. And that has worked beautifully in keeping the population also well informed, because the population has high trust in their primary care physician.
Dr.
So I think
Neville,
I'll
what
stop
about
there.
challenges? Tell us.
Oh, challenges.
Challenges.
Challenges, again, I mean, the resources are typically always a challenge, especially in a health emergency. I think if we have to be practical, if you go up to your minister during a health emergency and tell him, you know what, I need to invest X amount of money in setting up an epidemic management unit. He'll tell you, yes, okay, fine. Shall I give you the money, or shall I buy new tests with it? Or shall I buy treatment with it? Or shall I build a temporary hospital with it? So it's a bit difficult, to secure funding for initiatives like this in a health emergency. So
And
that
that's where
was
the
challenge.
WHO can jump in, isn't it?
Indeed. So if we take out misinformation from just something to be used in health emergencies and use it for challenges such as this one, I can assure you that the epidemic management community, of which I'm quite an active member globally, is very happy to see this development actually. No sector has exclusivity to epidemic management, not even health. When you think about it, it's not something that only health can benefit from. So we build this in, we build these skills into our staff, into our professionals, and also we build capacity within the different countries to tackle misinformation also for other purposes. I think we will actually, frankly, be better prepared also for the next health emergency, because we will have health capacity already in place. I'll stop there. Sorry, I took too much.
Thank you very much. I'll get back to you in the second round of questions. Thank you very much,
Sure.
Dr. Neville. So let's now move to North Macedonia. We have with us Dr. Sasha Miszewska. She's the medical director of the University Clinics of Endocrinology, Diabetes and Metabolic Disorders, North Macedonia. Dr. Sasha, are you with us? And can you please tell us a little bit more about the challenges you have been facing in fighting misinformation regarding NCDs, Dr. Sasha?
Yes, thank you very much for this possibility to speak. I will speak generally regarding the management of patients. I'm working with patients with diabetes, and many of them come with misinformation regarding medicaments. Those medicaments that have been actively and aggressively commercialized are mainly registered as food supplements, and as such they can be commercialized, but these aggressive commercials have led to people even stopping their treatment for diabetes. Here we have a successful story in terms of that we have included the Ministry of Health, we have included the societies of the National Societies of Endocrinologists and Diabetologists, we have included the patient societies, and even created a web page of the university clinic where we shared the negative impact that these food supplements can have in the treatment of patients. So all of the stakeholders can be gathered, but we don't have a continuation, and we don't have a platform that will provide us a continuous feedback on misinformation regarding diabetes in our country. So this is one challenge that we're facing, and the other challenge that we're facing is when people are led to believe that going abroad and having a surgery might help them cure diabetes. And this or let's say inter-regional things are very difficult to tackle. For example, in our country, we have this cybercrime law in place, but this is local, and we need, I believe, regional instances how to tackle misinformation on a regional level. So we have had people who have underwent surgery completely unnecessary, and then stopped their medication and came back in a very severe condition. So this is something that we need further to discuss.
Dr. Sasha, what do you think can be the role played by the WHO in order to support member states tackling these challenges?
Yes, well, I highly congratulate you on this initiative that you have. I believe that this regional, interregional, and collaboration is very important. So we need to have stakeholders in different countries that we can approach if we have a problem in another country, let's say. So this is
good. Thank you very much, Dr. Sasha. We'll get back to you in the second round of questions. And finally, let's move to Portugal. We have with us Diana Mendes and Miguel Tel de Arriaga from the Portuguese Directorate General of Health. Miguel and Diana, are you there? Can you please tell us a little bit more of your experience, namely on a very interesting project you developed during the pandemic, that is the social micro-influencers project, and the role of social media platforms in your perspective as a member state representatives?
Okay,
Miguel,
maybe Miguel, you can start with the micro-influencers network.
Okay. Yeah, thank you so much. First of all, let me congratulate WHO and all of the colleagues that developed this platform. We are really happy to share our experience, and of course to congratulate you in this event. Okay, so for us during the pandemic, and I would say that if you allow me, that will be probably one of our first challenges, Francisco, because during the pandemics, everyone was focusing to the same subject. So we are all navigating to the same place. And when we talk about NCDs, then we have different issues, because the population, the stakeholders, and everyone has to be involved in a different way, but all running to the same within the same path. So for us, when we were building up our national strategy, we put in one of the subjects was population engagement, and then we decided to put it really into practice. So we thought about building up a new project with unusual stakeholders that could help us out to take the message to everyone, having and really taking into account the code, leaving no one behind. So we had the police, firefighters, the people from the civil society, from the different areas where they could head into their daily jobs and to take information related with COVID-19 and to share it among the people that they were facing in a daily basis. So we had like a kind of a connection between the central departments and the government and the people that were on the field, with a person that usually could have difficulty in accessing the information and probably also not understanding what we were facing or the messages that were being spread, for example, in the media. So that was really, really helpful for us. We developed a national toolkit for these micro-influencers. So they were all saying the same thing, using the same language. We told them, teach them communication techniques. So it was like a broader approach in order for them to have some tools.
That's very interesting. That's very interesting
practice.
indeed. Yeah.
Yeah, it was really useful. We felt it, that it was useful, and now we are being evaluated with the help of WHO to see how can we improve this project and scale it up to NCDs, not only for emergencies. And that will be like a huge challenge. But maybe I will now give the word to Diana so she can add something else.
Diana, jump in.
Okay, so thank you once again for this invitation. I work especially with the communications department, and I work together with Miguel about our experience in monitoring misinformation and social media, fake news especially. That was one of our main challenges in the COVID area. It still keeps ongoing, but I think we have 4 or 5 points that I can speak about. We developed specialized partnerships with the fact-checking networks, and I think this was a huge success for us because in the beginning, with the uncertainty and the false information circulating, when we knew nothing or almost nothing about COVID-19, this is a very interesting way of tackling and answering as fast as we can the fake news and misinformation that were ongoing, especially on social media. We also, I think it's very important to build and to monitorize the comments and social media trends and the most searched topics about health. This was, I think, a good strategy, not only on COVID-19, but in other areas and in NCDs, I think it applies also. And to build concrete materials that can answer and give tools to the population that can help them feel the weight of each disease, and something more concrete, specialized materials like I should eat less sugar, how much sugar is in this specific food, like cereals, for example, or by storytelling, letting people identify with the story and to emotionally be involved in the story and apply the recommendations that we wanted specifically. But also working with the media. I think it's very important it was very important to answer quickly, as fast as we can, the media questions, and it was very difficult to do it, especially in COVID-19, because we had hundreds of questions, of course. But I believe that in this new era, and especially with NCD, one of the main challenges is to build media literacy also, and not only the population literacy, because I think we have a lack of information, and I believe this is one way that the WHO can help us, is building toolkits about scientific information, how to understand and to interpret scientific studies. Because I do believe that journalists are not as well specialized as they were, because the teams are really smaller, and they need help to understand and to interpret, because they can distinguish what is a good study from a bad study. And this could be very helpful, just to give some examples.
Thank you very much, Diana. And you already started like giving like examples of how the WHO can actually support more member states. And by reading the toolkit, and I'm sure everyone that is listening to us will have the opportunity to do it in detail, but the name and the expression social media platforms is like used several times, and curiously, and as one of the report co-authors, I was surprised because we found very good examples and initiatives even from the social media platform side. So I would like to pass the word to Dr. Garth Graham, that is represented in YouTube here with us. And are you there, Dr. Garth?
I am, Francis.
So I would like to ask you about some good case studies and good examples on how YouTube actually was able to collaborate with member states and with NGOs or with the academia in order to fight misinformation during the last years, last months.
Yes, Francisco, and again, congratulations to the team on the report. And thank you for having us. You know, a lot of what comments that were just made, I don't want to duplicate because I think I agreed with a lot of the sentiment, especially around health literacy and how we make information engaging. Over the past many years, as we tackled this issue through COVID, we've thought of it along the lines of for good information. And how do you consider the span of misinformation as well as high quality health information? And so for us, we think about it along what we call the 4 R's. The concept of how do you remove harmful information, harmful misinformation, how do you reduce its visibility, but how do you raise and reward good information? And along the line, similar to I think what Portugal did and us working with a number of local health authorities, we worked with the WHO and various governments on just that, how to get good information in front of communities, working with collaborators and influencers. One example, Francisco, as you were asking about case studies, was our work, particularly with the French government, with President Emmanuel Macron of France in particular, who challenged very popular influencers to make information that would reach people. And one particular piece of content reached over 10 million views in just a couple of days, illustrating how you can make information engage with hilarious musical tribute around COVID and the kinds of things that to remain safe. Again, sort of kind of the work that you heard described in Portugal, but it just shows you how the information can be made engaging and that people are looking for good information while we continue to remove and reduce the visibility of bad information. One other point you mentioned, and it's going to be somewhat repetitive because it goes to, again, what our colleagues just said in terms of what's needed. And you know, what's really needed is, again, this kind of whole of society approach, much like we're talking about today. But we need to invest in teaching and promoting online communication skills for healthcare professionals, for public health leaders, and so how we counter misinformation when patients bring it up in the clinic for even individual physicians. But then how do we make information engaging and reach people where they are along their information journey? So really looking at that whole spectrum of how we tackle information for the overall.
Dr. Garth, but I'm sure you also, as a platform, have been facing some challenges, like to reach out to governments, to reach out to the other stakeholders. Is it true or not?
Yeah, you know, there were a lot of challenges as we all face, especially during a very dynamic issue like COVID. And particularly in COVID, you know, you saw countries that were at different stages of the pandemic, and you know, guidance or information may have been evolving at different stages on a country by country basis, while we are dealing at a global level across many countries simultaneously. So for us, you know, ensuring consistency across regions and differing kind of stages and guidance from local dynamics was in particular a challenge. But it's one that, you know, again, kind of speaks to the dynamic, continuous evolving nature of challenges like COVID, but also speaks to opportunities in terms of how we work on non-communicable diseases.
I'm afraid okay. Thank you very much, Dr. Garth. And I'll get back to you in the second round of questions. And I would pass the word right now to the academia side. We have with us Emily Dennis, she's a PhD candidate from the Institute for Physical Activity and Nutrition. Emily, are you there?
Yes, I'm here. Thank you for having me.
Yeah, it's a pleasure for us. So can you let us know if this topic of health misinformation is a relevant one, even from the academia perspective and the medical students' perspective? What is your position on that?
It's certainly become it's become much higher on the research agenda. We've just completed a systematic review about nutrition misinformation on online platforms such as websites and social media. And what we've seen is that there has been a great proliferation of the amount of studies that have been published in recent years. So there's been much more research. It's become a much more topical issue, and it's more present on agendas for nutrition societies, nutrition communication throughout different societies across the world have now had it as a key agenda item as priorities for nutrition professionals, and it's certainly something within academia that there's been a lot more attention on.
So what about like a successful case study of collaboration between academia and one of the other stakeholders we have in this report, like government, social media platforms? Can you tell us a little bit about that?
Yeah, within the Australian context, there's been some recent legislation. So what we've found in our research regarding nutrition communication on social media and nutrition misinformation on social media is that there is a really large amount of marketing of dietary supplements and a lot of claims being made about dietary supplements and their ability to prevent and treat non-communicable diseases. And the Australian government's Therapeutic Goods Administration has recently passed legislation that has put some regulation around the types of claims that can be made by influencers regarding things like dietary supplements. So there's now a ban on personal testimonials and any promotion on social media by brands about any kind of performance of the product that has not been proved. And there's recently been large fines handed down to prominent supplement companies who have made claims about their products' ability to prevent and treat things like Alzheimer's disease. So I think that that's really promising first steps, but there's a lot more work to be done, certainly.
Thank you very much, Emily. I'll get back to you later. And let's now go and give the word to NGOs. And the meeting we organized with NGOs to inform this report was memorable. I can still remember it, and very good interventions we had. And one of the main actors of this meeting was Havas. So I would like to give the word to Luca Nicotra, that is one of the Havas campaign directors. Luca, are you there?
Hi, good morning or afternoon, depending on where you are.
Welcome.
Thank you so much for inviting us.
Yeah, welcome. So can you tell us a little bit about one successful case study you may have of your work in collaboration or with government, academia, or even with social media platforms, for starters?
Yeah, for sure. I mean, as you know, Havas is a global organization, and our goal is kind of to empower citizens, right, to tackle some of the biggest threats of our time, one of which is disinformation. And starting with the challenge, I think the first challenge for us has been fundamentally making both the public and decision makers aware of the magnitude of the issue, and evaluating also the efficacy of the tons of measures taken by social media platforms, right? And so I know they're included in the report, but we have published the reports, showing how at the top of the pandemic, the top 10 disinformation sources were receiving 400% more visibility than WHO, CDC, and all the health institutions together. And this was at the beginning, and later, and not just about COVID. And later, like 1 year later, we also showed that while platforms were successfully somehow dealing with misinformation in English, Europe had been left behind, and disinformation was still rampant in languages like Italian or Spanish or German, French, not to talk about smaller Eastern European languages. So
what did Havas do about that?
Yeah, and that's the collaboration side, because actually we have worked with a lot of academics, social media employees, integrity experts, but also, directly with social media companies. And we have worked on 2 of the solutions that are also included in the, powerful toolkit you put together. And so the first one, detoxing algorithm. So the idea to stop promoting disinformation, especially from sources who have repeatedly shared disinformation, but also just very simply informing everybody that the platform have been exposed to disinformation. And as Francisco mentioned before, this is like a known, and there is science backing that this really works. I think in terms of the successes, apart from having the measures in the toolkit, which I will put there, I think more importantly, the fact that some of the platforms have implemented those during the pandemic has been fundamental, but also some of these measures have become cornerstone of new EU regulation. The Digital Services Act, first and foremost, but now more recently also the so-called EU Code of Practice on Disinformation. And I must say that when the EU Code of Practice is basically, we're one of the few NGO that helped co-drafting it, and has also created a task force, a multi-stakeholder task force that will be in charge of monitoring the effectiveness of social media platform actions against misinformation, including health misinformation. And going to your third question, if I think what could be the biggest contribution from WHO, and especially WHO Europe, is it was actually somehow collaborate or become part of this multi-stakeholder process. In many ways, I think the task force for the EU Code of Practice on Disinformation is de facto the first manifestation of this triple intent that is mentioned there. And I think WHO Europe presence there would be game-changing fundamentally to make sure that everything we've won during the COVID emergency is kept as measures that can be implemented in the long term for non-communicable diseases. So yeah, thank you again, and
thank you very much
congratulations for the amazing
inputs.
work.
Thank you very much. So let's give now the word to EDMO representative Laurie Tierala. How are you, Laurie?
Hi, hello and greetings from Florence.
So can you please tell us a little bit of your perspective as an NGO regarding the importance of this toolkit, eventually a good case study, and the challenges you have been facing?
Sure thing. EDMO is an umbrella that brings together actually right now 125 different types of organizations, from academia to indeed NGOs, fact checkers, media literacy activists, etc. And I think the relevance of the toolkit is indeed obvious and high, and congratulations for the team responsible for the multi-stakeholder and multidisciplinary approach is indeed what we believe in as well. And if I may, instead of a single case study, I would actually bring forth the very fact that we've been able to bring together so many different actors across Europe to work on the biggest disinformation campaigns during the past 2 years. On the challenges side, I would say that two aspects of disinformation that we see are challenging for especially public authorities. One is that both are linked to the very nature of it. One, obviously, how it crosses borders at lightning speed, and of course, all the national authorities trying to contain something that crosses borders instantaneously is by definition very challenging. But the other, and I think that's actually more relevant for this discussion and your work today, is the way how disinformation actors can jump from one field to another in a day. The same actors behind disinformation regarding COVID started spreading disinformation regarding the war in Ukraine. Last spring can jump to some other topic, in next month can jump to another, etc. So every sectoral approach to tackling disinformation is therefore as it's needed, absolutely, but it's also limited unless different authorities across sectors can cooperate.
Thank you very much, Laurie.
Sure, thank you.
And finally, from the NGO side, I would like to give the word to the Patient Information Forum. We have Dan and Sophie with us. Dan and Sophie, I would like to ask you about your NGO perspective on how important is still this problem, and if this report is still timely, because COVID looks like having been like far away already, but is this still a real problem?
Yeah, absolutely. It's a real problem, and we see that in our work all the time. And I think, interestingly, when you look at COVID, there was a huge amount of official information, both from WHO and national governments, to counteract the misinformation. And when you look at non-communicable diseases, that's just simply not the case to the same extent. There's not that concerted effort. So we've been approaching it from a slightly different way. We've been certifying trusted information producers. And so that we asked the public, and it was before COVID, if they needed support to identify trusted information via signposting of trusted information. We had 80% said yes. So we've been working on a new scheme to certify through a robust process of assessment information producers, and we work across sectors. We're happy to work with all sectors. We work with the charity sector in the UK, which is a very large sector, and it's probably the most developed health information production sector. We work with private sector companies and indeed with the NHS. So we do think that there is still a massive need in this area. When we've worked recently, and I do think the triple entente is the absolute way to go. So we've worked with NHS England recently to help them develop a new content standard for NHS organisations. They took our PIF-TIC criteria, which are co-created with our cross-sector organisations and independent experts, to set out what is trusted information. And they've taken that to create a new content standard that organisations can self-certify against. And I think, Garth, we saw you talking about this in the summer in an NHS conference, that NHS organisations that meet that standard will now be able to get onto a new health shelf that you're developing and piloting soon. So I think that's a really helpful way for people to be able to identify trusted information against misinformation. We've come across this very recently. I know we talked about health literacy a lot, and I think that's fundamentally important. And again, I believe fundamentally that trusted information producers have to engage people. They have to be health literacy friendly. The information has to be easy to digest and understand. It may be image based, it may be video based, which is why we need this wide coalition to provide trusted health information. But interestingly, we've talked a lot about nutrition, and we've been working with one NHS organisation in the UK on some material to get people ready for surgery. And we were co-producing this with a group of patients. And as soon as people saw BMI in that information, the words BMI or body matrix index, they immediately said, well, this is rubbish. This is completely discredited. Nobody uses it. All of this information that you're giving me must be wrong because you've used this. So actually, it's the evidence-based tool that the NHS use to assess people's fitness for surgery and other things. And obviously, a huge contributor to many NCDs. So we went through quite a big, extensive consultation process with our membership, and we were able to identify indeed that, in fact, this is a big issue. It's one healthcare professionals are really struggling with. So we kind of co-created with them a kind of mythbuster on BMI, which we've recently launched on our website, along with other guides to spotting misinformation. It's been really popular. So I think these things can be quite subtle and nuanced, and you don't necessarily know about the extent or the impact of that misinformation until you start talking to patients. So yeah, I would say those are the key things. And I think moving forward, we need to define what WHO can do is really define what is trusted information, and then build together this coalition of all the solutions we've seen today and pull that forward.
Thank you very much, Sophie. And because we are already quite late, I would like to challenge all of our panel discussion members to be very objective in our last round of comments. Because being a former WHO consultant, something I realized is that sometimes we have plenty of information, plenty of reports, plenty of frameworks, but the real challenge, and I've discussed this with Kremlin and João Bareda several times, the real challenge is implementation, is commitment. So my final question for each one of the panel members would be, how are you actually delivering some results and commitment on this toolkit framework and on this toolkit? What are your organization doing? I will start by Dr. Garth. What is our social media platform representative committing to do here, Dr. Garth? And then let's move to the others.
Sure, Francisco. I can only speak on behalf of us. And two things I would say to Sophie's point, and we're working on the WHO with this, committing to the issue of identifying sources of good health information. Also committing really to bring together and work with member states or way in which we can all come together and work across countries and across
Thank you very much. We are having some trouble with the connection, but let's move to the member states representatives we have in the room still. So can we hear what does Malta, North Macedonia, or Portugal intend to do with this toolkit to better collaborate with the other stakeholders? Nabil, are you there?
Hi. To be honest with you, we have already we're kind of coming out from the emergency of COVID, so we're kind of evaluating our communication there. Nonetheless, as you said in the beginning, as some of your colleagues said in the beginning, we have been aware of issues affecting health literacy, through people, whoever goes on radio, etc., etc. And in fact, we are hoping to start at least working with media personalities, journalists, etc., also on how to consume information and how to appraise information. That won't close the net, of course, because something else we've noticed over the last 2 years is that there have been a lot of online small media outlets, if we can call them outlets, that have spawned and multiplied over the last 2 years, as finding a market kind of thing. And these are difficult to control. But nonetheless, I think the population still has some basics of trust, of which sources to trust more than others. We sometimes need to reinforce that. But basically, I think we're in a sort of evaluation phase, I must say, as a member state, in trying to revisit how we have been doing health education and health advocacy, and see how we can integrate more infodemic management in order to clear the way for the right messaging.
Good. Thank you very much. Now, Dr. Sasha Mishevska from North Macedonia.
Yes, well, I can yes.
What are you planning to do in order to operationalize at least one of the recommendations of the report?
Okay, so now I'm speaking about diabetes. What we have done so far is we have prepared a national strategy for diabetes, where media information is one of the key points that need to be tackled. We collaborate with the ministry, and here in this media part information, we feel that we will need a lot of support in terms of hitting good media platforms that people can trust. So this is one of the agendas that we need to work on.
Good. Thank you very much, Dr. Sasha. Diana, Mins, and Miguel, very, very quickly, one commitment, one very operational idea to move forward from Portugal.
Okay, from my side, I think we are still evaluating, of course, our strategies, but we are trying to build more alliances with both social media networks, but also with the...
You have Dr. Garcia, just text him right away.
Okay, we'll keep in touch. And we are still building and more effective ways of working with the NGOs, of course, and also with the media. These are some of our strategies. I don't know if Miguel has something to...
Yeah, just like in 20 seconds, I would say that one of the key words in following Francisco could be also to make and to use your toolkit to make our measures and initiatives sustainable. That I believe that could be one of our major challenges for the future. And then to head up health literacy and behavior and cultural insights and putting in them work together because we feel like, and we learn a lot from the pandemics, that together we will be having more good effects for the things that we hope. And so that will be going along with the communication spaces that we also need to be in, because we know and we also learn that if we are not there, someone will occupy that space and probably had the chance to promote some not correct information or not official information. So we need to be where people are. And again, we also need to answer and to give people information that they really need. So that will be lots of challenges, but I would say that the toolkit will be a very important tool for us. Thank you so much.
Thank you very much, Miguel and Diana. And now 30 seconds for each. Emily, Dennis, one commitment from the research side. What are you planning to do to actually starting operationalize the recommendations from the toolkit?
So the Australian government are currently in a consultation phase for the National Health Literacy Framework and Strategy. And part of that consultation phase, the institute that I'm a part of are going to be contributing to that, and we'll certainly be using this toolkit to advocate for media literacy as a key component of health literacy and something that should be included in that strategy.
Thank you very, very much. And now, Luca, Laurie, and Sophie from the NGO side, please tell us.
I mean, as I mentioned, Avaz is actually one of the signatories of the UCORA practice on disinformation, and within that, we have taken specific commitments, and we're going to be evaluated with specific measurements on those commitments. And just to give you a few examples on the size of the audiences we reach with our media literacy initiatives, to develop scientific guidelines for all our research and share publicly all the data wherever possible and methodologies. And yeah, the code includes 128 commitments from all multi-stakeholders. And let's see, yeah, in January, we'll see how it's going.
Thank you very much, Luca. I believe Laurie is no longer with us, but Sophie and Dan from Patient Information Forum are still with us. Sophie and Dan, one last.
Dan, over to you.
Thanks, Sophie. So as Sophie's just mentioned, we're at PIF, part of the new UK-based Media and Information Literacy Alliance, representing education, health, libraries and academic organisations on the combined strategy to make sure health literacy is really important and that everybody gets the access to the information that they need, because health literacy and numeracy and digital accessibility are all key things that PIF are working on.
Thank you very much. And that said, I would like to thank everyone for the amazing inputs. It was like a very large number of people for a very short period of time. I think we would have a lot to say with more time. But the more important thing is that it's to see this room, this digital room, full of people from different areas, different sectors committed to collaborate. Because again, the word that comes out from this report is the need for further collaboration. I hope this is the beginning. This toolkit will be the beginning. And with this word, I will pass the word back to my former boss, Kremlin Vikramasinghe. Kremlin, you have the word. Thank you very, very much for all the support and for bringing this up again, this toolkit. Kremlin.
Thank you, Francisco. Thank you. I think the panel was a real example of the recommendations from the toolkit. Need to bring together stakeholders, different perspective, what each of you are doing, and how can we amplify that together by working together and sharing that information and building capacity. So as WHO, within our capacity to bring member states and supporting them with their actions, We really look forward for all of your support, all the stakeholders, to make it a reality and take this toolkit further and implement those actions. So briefly, I want to thank all the member states who joined the development of the toolkit, all the consultations, but also who are speaking today at the panel. So all of them, thank you to all the member states. And all my, everyone from WHO Europe, from our regional director, Dr. Hans Kluge, from Dr. Nino Bersuli, our director, for their support and guidance on this. And also everyone else who joined today, Dr. Joao Breda, for initiating this when he was the head of the NCD office, but also continuing the collaboration now from patient safety angle, but also colleagues from WHO headquarters. I want to particularly thank all the authors who are here. You heard from them, most of them today, Francisco, Joao, and both Francisco de Silva and Durate, for all of your hard work last few months, and also for Catherine Hertz, who was coordinating the finalizing and organizing the launch event with all the stakeholders. Thank you to Catherine. And Olga Olenik and Aram for all the admin support for this launch event. All the speakers from Australia to US and Europe, all those different time zones. Thank you so much for accepting our invitation and joining at these early hours and late evenings from your side. Thank you to all of you. I'm not going to say names because of the lack of time, but the toolkit is now available online, and we would really look forward to working with you with the follow-up actions, but also to update you about those activities. And we really hope you will collaborate with us. Thank you from the WHO European Office for Prevention and Control of Non-Communicable Diseases and WHO Europe. But we wish that we all can meet again and take this agenda forward. Thank you and bye-bye.
Thank you.
Thank you.